If your kidneys could speak right now, they might be quietly begging you to stop doing something you did just this morning, something that feels completely normal, harmless even. But over time, I've seen it slowly damage the body in ways most people never connect, until it's too late. Before we go any further, take a moment to like this video and subscribe. I share this kind of critical health insight because the earlier you know, the more power you have to protect yourself. What I'm about to tell you might surprise you. Because the biggest threat to your kidneys isn't always what people expect. It's not just alcohol, not just medications, and not even just sugar on its own. It's something far more subtle, something hiding in everyday foods, sitting quietly in your kitchen right now. I've sat across from patients who were doing everything right. They avoided junk food, tried to stay active, and still, their kidney function kept declining. And when we looked closer, there was one common pattern, one overlooked habit, one daily exposure that slowly added stress to their kidneys day after day. Most people don't realize that your kidneys are working nonstop, filtering your blood, balancing fluids, managing electrolytes. They're incredibly resilient, but not invincible. And the damage they experience often builds silently. No pain, no obvious symptoms, just gradual wear, until the signs finally show up when the condition is harder to manage. Maybe you've noticed feeling more tired lately. Maybe your ankles swell slightly by evening. Maybe your blood pressure has crept up without a clear reason. These are small whispers from your body, and they matter. The problem is, we're not taught to connect these dots early. We assume it's aging, stress, or just one of those things. But I've seen this happen too many times to ignore it. There's a hidden kidney stressor that blends into daily life so easily, most people never question it. And the more frequently it becomes part of your routine, the more quietly it can affect your long-term health. In the next moments, I want you to listen carefully, not with fear, but with awareness. Because once you recognize this pattern, you can make simple changes that may help support your kidney health in ways you didn't even realize were necessary. Let me gently guide your attention to something sitting in almost every kitchen I've ever visited. Something so common that most people don't even think twice about it. And yet, in my experience as a kidney specialist, it is one of the most overlooked contributors to long-term kidney stress. I'm talking about highly processed, packaged foods that quietly rely on one powerful ingredient combination: excess sodium, hidden preservatives, and chemical flavor enhancers. Now I want you to pause for a moment and think about your last few days. Packaged bread, instant noodles, canned soups, sauces, snacks, maybe even healthy-looking, low-fat meals. They often taste fine, sometimes even light, but inside them can be levels of sodium far beyond what your body naturally needs. What most people don't realize is that your kidneys are responsible for filtering and balancing sodium in your bloodstream. When sodium intake becomes consistently high, your kidneys are forced into overdrive. Not just once in a while, but every single day. I've seen this pattern repeatedly in patients who were otherwise healthy. They didn't overeat sugar, they weren't drinking alcohol excessively, but their routine diet was quietly loaded with processed ingredients. And over time, their kidney function tests began to shift in ways they didn't expect. The body does try to compensate. At first, you might not notice anything at all, but internally, your kidneys may begin retaining more water to dilute the excess sodium. This can lead to subtle swelling in the hands, feet, or face, a slight increase in blood pressure, a feeling of heaviness or fatigue that people often dismiss. What makes this even more concerning is that many packaged foods are designed to not taste too salty, even when they contain high sodium levels. That's the tricky part. Your taste buds can be completely unaware of what your kidneys are struggling with. And it's not just salt alone. Some preservatives used in processed foods may place additional strain on the filtering system of the kidneys, especially when exposure is frequent over many years. It's not about fear, it's about accumulation. I've had patients look at me and say, "But I don't eat unhealthy food." And then, as we go through their daily meals together, we slowly uncover the hidden sources they never considered part of the problem. This is why kidney health awareness matters so much, because the damage, when it happens, doesn't announce itself loudly. It builds quietly, almost respectfully, until your body can no longer compensate the way it used to. Now, I want to take you a step deeper into something even more surprising, because sodium is only part of the story. There is another hidden pressure on your kidneys that most people completely overlook, even when they are trying to eat better. And it comes from sugar, not just the obvious sugar in desserts, but the hidden glucose load in everyday foods and drinks that don't even taste sweet. Let me explain this in a simple way. Your kidneys are constantly filtering your blood, helping to regulate not only waste, but also glucose balance. When blood sugar levels stay elevated, even mildly over long periods, it forces the kidneys to work harder than they are designed to. I've seen this especially in people who are not diagnosed with diabetes, but are in what we call a pre-diabetic range. They feel fine. They may not notice anything unusual, but internally, their kidneys are already under extra strain. What makes this dangerous is how quietly it develops. There is no sudden alarm, no immediate pain. Instead, there is slow, ongoing stress on delicate filtering units inside the kidneys called nephrons. And once those structures are damaged, the body cannot easily replace them. You might be wondering, but I don't eat much sugar. And that's exactly what many of my patients tell me. But when we look closer, we find things like sweetened tea, packaged juices, flavored yogurts, breakfast cereals, and even sauces that contain hidden sugars. Over time, this constant exposure can contribute to changes in kidney function. It can also work together with high blood pressure and sodium intake, creating a combination that increases overall strain. One of the earliest subtle signs I often see is changes in urination patterns. Not dramatic changes, but small ones. Slight increases in frequency, a feeling that something is off but not serious enough to worry about. And because life is busy, these signals are often ignored. What I find most concerning is how normalized these dietary habits have become. We live in a world where quick and convenient often means higher hidden sugar and sodium intake, without people realizing the long-term impact. Your kidneys don't complain loudly. They adapt, they compensate, they keep going until they can't maintain that balance anymore. And that is why early awareness matters so much. Because by the time most people feel real symptoms, the changes inside the kidneys may have already been developing for years. There is something I need you to understand clearly, because this is where most people become confused and where real kidney stress often hides in plain sight. It's not only what you eat, it's also what you drink. I know that sounds simple, even obvious, but in clinical practice, I've seen so many people overlook this completely because beverages feel harmless. They don't seem heavy like food, but your kidneys experience them very differently. Let me ask you something gently. What did you drink yesterday? Tea with sugar, bottled juice, soft drinks, maybe even those energy or flavored drinks that promise refreshment? Most people don't realize that sugary and artificially sweetened beverages can create a rapid load on the body. When sugar enters the bloodstream quickly in liquid form, it causes sharper spikes compared to solid food. And your kidneys, working closely with your blood system, are part of the response to that imbalance. Over time, repeated spikes in blood sugar levels can place continuous strain on kidney filtration. Even if someone is not diabetic, these fluctuations may still contribute to long-term stress patterns inside the kidneys. And then there's another layer that often surprises people: dehydration. I've seen patients who drink a lot of beverages but still have mild chronic dehydration. Why? Because drinks like coffee, strong tea, and sugary sodas do not truly hydrate the body in the same way water does. In some cases, they can even increase fluid loss. When the body is not properly hydrated, the kidneys must concentrate urine more intensely to conserve water. That means they are working harder even during rest. Day after day, this added workload quietly accumulates. One of the earliest signs I notice in patients is darker urine, or a slight reduction in how often they naturally feel thirsty. Many ignore it. They assume it is normal, but the kidneys are already adjusting internally. I've also seen people develop mild fatigue that they cannot explain. They sleep, they rest, but still feel drained. And when we gently adjust hydration habits and reduce hidden sugar intake, they often describe feeling unexpectedly lighter over time. What I want you to take from this is not fear, but awareness. Because your daily drink choices are not small decisions. They are part of your kidney's workload every single hour. And the challenge is, the body rarely tells you immediately when something is wrong. It adapts so well that warning signs come slowly, almost quietly, until they start to become impossible to ignore. Now I want to talk about something even more overlooked, because even people who avoid junk food and sugary drinks can still be exposed to a hidden stressor their kidneys feel every single day, and that is medication use, especially over-the-counter painkillers. I want to be very careful and responsible here. Medications have an important role in healthcare, and when used correctly, they can be extremely helpful. But what I've seen in long-term kidney care is a pattern that many people don't recognize until damage has already begun. Common pain relievers, used for headaches, joint pain, or back pain, when taken frequently or without medical guidance, can place extra strain on the kidneys over time. Not immediately, not dramatically, but gradually. I've had patients tell me, "Doctor, I only take them when needed." And when we explore further, we realize when needed sometimes means several times a week for months or even years. That's where the hidden risk often lies. The kidneys are responsible for filtering many substances from the bloodstream, including medication byproducts. When exposure is occasional, the system can usually handle it. But when it becomes frequent, the filtering load increases. What makes this especially concerning is that early kidney stress does not always produce clear symptoms. People continue their routine, unaware that subtle changes are happening internally. Sometimes the first clues are indirect: slight changes in blood pressure, mild swelling in the lower legs, or lab results that show early shifts in kidney function markers that the person didn't expect. I've seen individuals who were otherwise healthy, active, and careful with their diet, but their kidneys were silently under pressure from long-term repeated medication exposure combined with other lifestyle factors. This is not about blame, it's about awareness, because many people are never told how important it is to consider cumulative effects over time. Your kidneys don't experience each day in isolation. They experience patterns, repetition, accumulation. And when multiple small stressors come together, processed foods, hidden sugars, dehydration, and frequent medication use, the overall load becomes much greater than most people realize. One of the most important things I encourage patients to do is to look at the bigger picture of their daily habits, not just individual choices. Because kidney health is rarely affected by one single factor, it is shaped slowly, quietly, over time. And the earlier you recognize that pattern, the more opportunities you have to support your body before serious changes begin to develop. At this point, you may be starting to see a pattern forming. Not one dramatic cause, but a quiet combination of daily habits that slowly shape kidney stress over time. And here is what I often tell my patients when they feel overwhelmed by this information. The goal is not perfection. It is awareness and small, consistent corrections that reduce the burden on your kidneys. Because your kidneys are incredibly resilient, They are designed to handle fluctuations. They are designed to adapt, but they are not designed to carry a constant load of modern dietary stressors every single day without relief. In my clinical experience, one of the most powerful changes people can make is not extreme dieting or complicated routines. It is simplifying what the kidneys have to filter. That begins with hydration. Plain, clean water throughout the day supports the natural filtering process. When the body is properly hydrated, the kidneys do not need to concentrate urine under stress, and that alone can reduce internal strain. Then comes reducing hidden sodium exposure. Not by eliminating all salt, but by becoming more aware of packaged and processed foods. Cooking at home more often, even in simple ways, allows you to regain control over what enters your body. I also encourage patients to pay attention to their sugar intake in its less obvious forms, not just sweets, but beverages, sauces, and processed items that quietly contribute to blood sugar fluctuations. Stabilizing these patterns can indirectly support kidney workload. Another important step is becoming mindful of medication frequency. Again, this is not about avoiding treatment when it is needed. It is about having conversations with healthcare providers when pain management becomes a regular part of life, rather than an occasional one. What I find most encouraging is that even small adjustments can make people feel different over time. More energy, less bloating, more stable blood pressure. These are often early signs that the body is experiencing less internal stress. But I also want to be honest with you. The early stages of kidney strain are often silent. You will not always feel a warning. That is why prevention matters so much more than reaction. I've seen too many people wait for clear symptoms before paying attention, only to realize later that subtle signals had been present for years. So as you reflect on your own habits, I want you to think gently, not critically. This is not about guilt. It is about giving your kidneys a little more support in a world that constantly challenges them. And in the final part, I want to show you the specific warning signs that your body may already be giving you. Signs most people overlook until they become much more serious. Now I want you to focus very carefully, because this is where everything comes together, and where your body may already be trying to communicate with you in subtle ways. Most people imagine kidney problems begin suddenly, with severe pain or a dramatic health event. But in reality, early kidney stress usually speaks in whispers, not alarms. One of the first things I often notice in patients is persistent fatigue that doesn't match their activity level. They sleep, they rest, yet still feel drained. Many assume it's age, stress, or routine exhaustion, but sometimes it reflects the body working harder internally to maintain balance. Another subtle sign can be changes in urination, not extreme changes, but quiet ones. Perhaps slightly more frequent trips to the bathroom at night, or urine that appears darker or more concentrated than usual. These are often dismissed as hydration issues, but they can be worth paying attention to if they persist. Some people experience mild swelling in the ankles, feet, or around the eyes, especially later in the day. This happens because the kidneys play a role in fluid balance, and when that balance begins to shift, the body can hold on to more fluid than usual. There can also be changes in blood pressure. Even small, gradual increases over time may reflect increased strain on the kidney system, especially when combined with dietary and lifestyle factors we discussed earlier. What I want to emphasize is this. None of these signs automatically mean something serious is happening, but they are signals worth noticing, especially when they appear together or persist over time. I have seen many cases where early attention made a real difference. When people adjusted hydration, improved food choices, reduced processed intake, and became more mindful of medication use, their overall health markers often stabilized. And that is the message I want to leave you with most strongly. Your kidneys are not fragile, but they are sensitive to long-term patterns. They respond to how you live, not just what happens in a single moment. So if you take anything from this conversation, let it be awareness. Not fear. Awareness that your daily choices matter more than you might have realized. And that small, consistent changes can support your body in powerful ways over time. If this helped you understand something new about your health, I want you to take it seriously, but calmly. You don't need to change everything at once. Start with one small improvement today. Your kidneys will notice, and over time, your body will thank you in ways you can feel. Stay mindful of your health, because often the quietest warnings are the most important ones to hear.